There we go. You're amazing, Ed. You don't say anything. I'm teasing. Your left arm goes back. You see that crown here? So your left arm goes back at least that much farther, a couple inches farther back. Does that make sense?
Yeah.
Than your right. The right shoulder is rotated forward. Even the left, I'm not happy with. You should be able to look at me for that. Both these arms should be able to come.
Yeah.
It's okay. We're going to work on that in a second.
Okay.
There's an injury right here. Injury back here. Oh, there we go. It's all better. Shoulder doesn't want to be back here. Shoulder forward, jammed AC joint. Then you go do an exercise like a weighted shoulder shrug or bench pressing, and now this is not nearly as pronounced on his left. Tilt your head a little left for me a little bit. There we go. Yeah.
Wow.
Right shoulder, lower back, and neck.
Yes.
Tell me about let's do the shoulder first. Tell me how long it's been going on.
So I've been dealing with it maybe about close to 2 years now. And so I used to work out a lot.
Okay.
So I've kind of slowed down the past year and a half, 2 years. So I can still exercise, but when I'm in certain positions, sort of like here, I feel pain here,
Okay.
behind the shoulder also, upper trap, really locked.
What's the main exercise you were doing? Bench pressing?
Well, at first it was a shoulder shrug when I originally felt
Got it.
some discomfort. But like now, I can do a flat bench press now, but nothing, no inclines or overhead presses.
Okay.
I'm really feeling it there.
Okay.
I just have stiffness in the lower back from time to time.
Okay.
So actually the past 3 or 4 days since I've been down here,
Okay.
it's really been kind of tight. So when I'm sitting down for a long period of time, I get up and it's kind of a struggle to walk a little bit.
Okay.
Yeah.
Anything going down the legs? Do you feel
No,
any symptoms? Okay.
nothing in the
This is a pretty good shot of it. The tendon's actually, that's the arthropathy. The actual tendon's starting to calcify.
Okay.
That's why you're not supposed to be able to really see that. When you overstress a muscle, the tendon will, tear or get injured.
Okay.
The tendon dives into the bone. The bone's actually starting to grow because of that stress from the tendon bone attachment in there.
Okay.
So I can tell you've been how long you've been weightlifting for a while before?
Yeah, probably close to 10 years.
10 years. Yeah. This is so very similar to, if I overstress my skin, right? My skin gets thicker and I get a callus. To me, that's just a callus.
Okay.
It's from repetitive stress on tissue. It tries to get larger. So the word arthritis, arth means joint, itis means inflammation. So just whenever you hear the word arthritis, just think joint is inflamed.
Okay.
Well, it's hurting. I do a motion, it hurts. The center part of the glenohumeral joint, so the humerus sits in this little cup here called the glenoid fossa. The center of the glenoid fossa has the most amount of cartilage, like a lake. The shallow end is called the labrum, which is the lip, and the middle of the lake is where the most cartilage is. On your report it says, they call it degenerative. I kind of disagree with that word degeneration. When something's getting larger, it's not degenerating, it's regenerating, but it's
Okay.
kind of their nomenclature to call it degenerative. Basically, the cartilage is inflamed.
Okay.
And that's what's giving you that pain inside the glenohumeral joint. Have you talked to a osteo guy, or is anybody?
No, so I saw one shoulder doctor, and his first option was just shoulder replacement.
Right.
Yeah, so-
right.
Which I was.
Well,
Yeah.
it comes from overstressing. So the cartilage has no feeling. So when the bone touches the other bone, that's going to give you a lot of pain. The reason why we have cartilage is to prevent those two bones from touching. It's like a non-sensitive cushion. And if that cushion is torn, not where it's supposed to be, you start getting pressure between two things. It can be rehydrated. We can try to, sometimes they'll go in there, especially with the knee, they go in there and they reshape things. It's a tough one. They're saying there's a cyst also. So the bone's gotten bigger, and there's actually underneath the surface of the bone, there's a cyst.
Okay.
So there's
Did
fluid.
they tell you about that cyst?
No.
Oh, they didn't explain? Okay.
Yeah.
It's okay. We're gonna go through. I'm gonna go. It's like reading. Like when I read one of my lawyer documents.
Yeah.
It's all different language to me. None of these
Yeah.
words mean anything. So I'm trying to give you So underneath the bone, there's fluid formation.
Okay.
So it's like a bruise. There's a bone bruise. So you have the actual cartilage between the bone that's sitting in the cup. There's tearing of the cartilage. Underneath the bone, there's a bruise. And so it's no surprise to me that you're describing pain.
Yeah.
Now, they're actually describing the labrum as being okay. So the lip, a lot of times people have forward shoulders, and the more forward your shoulder goes, you actually start to tear up the lip of the shoulder, and there's not much cartilage there because most of the cartilage is in the middle. Now on your MRI it says superior labrum demonstrates degenerative frank. So the superior part, but no labral tear. So there's the top part of the labrum up here where the bicep sort of attaches is inflamed.
Yeah.
The middle's okay. But the part of my gist is to try to get the shoulder back into where it's supposed to be and see how much relief that can get you.
Okay.
So I doubt, again, the cartilage is extensive. There might be a big bruise here, you understand? But if we just move the shoulder back to a less bruised area, that might give you a lot of relief.
Okay.
I'm going to work on the shoulder, see if we can find a position where we can get the pressure off where the cyst is and where the tears are to maybe allow that, the cyst can go away. A lot of the inflammation around that cartilage can go away.
Okay.
But I'm not going to lie, it might need you might need to further, if you can't conservatively take care of it, this is extensive. The AC joint I can fix, I'll give you some positive. It says moderate degenerative changes noted the AC, so that acromioclavicular, so your clavicle attaches to the acromion. The more forward the shoulder goes, that jams that. That's pretty easy to fix, and I would call it cheaper. It's just a joint that's inflamed.
Okay.
The AC joint gets inflamed because of forward shoulder.
Yeah.
So opening up the chest, gua shaing, and I can clean that up. That's not that hard to fix. That cartilage is non-regenerable, so it's like a tread on a tire. Once it gets torn and ripped up, kind of like a meniscus in a knee, it's tough.
Yeah.
Is it basketball?
Yes.
Okay, how many years do you play playing basketball?
Played high school, college, but it's been probably 10 years since I played.
So your left hip is significantly elevated.
That's what okay.
So this is where it gets silly real quick. Someone will say your left leg is short, but it's because your left hip is high. Ultimately, that's usually done to avoid pain on the right. So now I'm not saying you have pain on the right, but my point is that your body did that to get away from something that potentially is there. This hurts. Oh, it's all gone.
Yeah.
I'm all better.
Yeah.
Your body moves things around, but that doesn't mean that the problem's not there. It's just being avoided. Now, because things have shifted, the muscles are holding everything tight because it's in the wrong position.
Okay.
So the tension, part of it is postural. Tightness is usually guarding. There can be guarding or bad posture.
Okay.
And when I work on you in a minute, I can sort of determine which one that is. The tension in the neck is the head's forward. The more forward the head goes, the tighter the muscles get.
Surgery, I'm trying to avoid that at all.
Well,
costs,
it's I'll do my best. I'm just saying that's a tough one. When the cartilage in there is torn up. Now, again, there's a lot of real estate in there. Do you understand?
Yeah.
The MRI report didn't say how much of that real estate. Maybe it's torn up only in one spot, and if we just move some pressure away from it, a lot of that the bruising can go down. Do you understand? It's not. There's components that can get better, and then there's components that can't.
Okay.
Or how about this? That can't be rehabilitated as easily. And so let's try to get pressure off of it and see what can change. All right, take a deep breath in and do a little sit up, and then head back for me. There we go. Let it all go. Take a little deep breath in for me. Head back. Let it all go. Let it go. There we go. Deep breath in. One more. Head back. Let it all go. Very nice. Very nice. Okay. Let's go to your side facing me. Just feeling. Here we go. Exhale. I got you. Is that for me? Good. That's it. Breathe. Exhale. There you go. Very nice. Face up for me. Here we go. Real easy. Here we go. Good. There we go. Good. Okay. All right. Okay, your right shoulder is definitely more forward. When you're laying here on your back, I mean, Carl, maybe you can see it from this angle a little bit. So this is the front part, right? Do you see like these lines here? This is about ½ inch. Your right shoulder is about ½ inch more forward than your left. When you're laying flat here on your back, this is more anterior. That's the AC joint inflammation because you got this thing jammed here on the front. Most chiropractors and almost all medical doctors want to focus on what they call the degenerated areas, the damaged areas. I try to focus on what isn't injured to take stress off the injured, right?
Gotcha.
So if everything is damaged, I guess I can't do anything.
Yeah.
Does that make sense?
Yep.
But I usually don't see that. I've never really seen everything damaged because of that principle of overworked, underworked. In order to have everything damaged, boy, by golly, you had to really beat yourself up. But generally, there's always some area that isn't injured that we can try to. There's always some teeth that aren't cracked.
Yep.
So let's try to identify all the parts that aren't injured and move the stress there. Teach you to use those areas as best as possible. I got a strong thumb, but my goodness,
Yeah, I can feel all
that
that.
is way,
Yeah.
way too tight up there. This is almost gone, actually. Your neck likes to tilt this way. Yeah, that's back to the right. Let me put this golf ball up here.
What causes that?
Injury, event
Yeah.
avoidance. You've had a right neck injury that made your head tilt left. So the same nerve that goes to your right shoulder, part of it can be when you were weightlifting or life, you injured the lower neck. That made your head tilt left. That injury, the right lower neck, affects your shoulder.
Okay.
So I think maybe the better analogy here. If you have a plant and you don't give it enough sunlight or water, the plant starts to get weaker, right? It starts to atrophy or fall apart, right? And then if somebody goes over and touches the plant, it crumbles and falls apart, right?
Yeah.
Well, you damaged it. Well, no, it was already weakened.
Right.
And then any stress to it caused it to get damaged. So I wonder about that sometimes with the shoulder. The shoulder can get atrophied, do you understand? Or the stabilization components of the shoulder can get weakened. Then you go do something athletic and it gets damaged easier than it should have been.
Gotcha.
Okay?
Yep.
That came up pretty quick there, but I'll get a bit bigger for you. But this is the gua sha. It's a little comb with a smooth edge, but it kind of right over that area, there's a lactic acid mark. So when you comb the tissue, anything internal that's not supposed to be there, any acidity, any lactic acid comes out as a mark. And I'll show it to you in a minute, but there's... Okay. This lock is causing the lower neck. See, that's where all the neck likes to fold down there. C5 is what goes to your shoulder. So the ability for me to help you today is dependent on if that nerve's pinched or not. Does that make sense?
Yeah.
Now I'm going to help unpinch that nerve irregardless, but my point is that just working on this is silly if we don't unpinch, if there is a C5 nerve injury, that has to be dealt with first before any care to your shoulder.
Okay.
Now today I'm going to do both anyway, but my point is that other people need to get on board with that.
Yeah.
That that's why I asked the question, has anybody felt this lump in his neck? And they're, no. Okay, well then nobody's identifying that if this is frozen, if his atlas on the right is frozen, then the lower neck is doing extra. And the lower neck is C5.
Okay.
And so that then goes to your shoulder. And that, to me, there's always almost like reading a story. There's a tale of what's going on here. And bit right there, yeah. Okay. It's okay. There it is. There we go. You're amazing, Ed. Not saying anything. I'm teasing. Okay, almost there. Come on. There we go. Okay, good. All right. Let's see that shoulder. Okay. All right. Your left arm goes back. You see that crown here? So your left arm goes back at least that much farther, a couple inches farther back. Does that make sense?
Yeah.
Than your right. The right shoulder is rotated forward. Even the left I'm not happy with. You should be able to look at me for that. Both these arms should be able to come.
Yeah.
It's okay. We're going to work on that in a second.
Okay.
We're going to compare that in a second after I work on them.
All right.
Objectively, your left shoulder is not only your neutral position, it's more in the right position, but also when we actually ask your shoulder to come back, your left shoulder goes farther back than your right. Hence, when you do an activity with the wrong alignment, the ability to be injured is higher, right? So because your shoulder most likely was forward when you did the shoulder shrug, you're saying this shoulder was more forward when you did the shoulder shrug, making this less stable and more likely for a chondral tear. You understand? You tore the cartilage because the alignment was improper or misaligned before you did the exercise. Rotator cuffs, for instance, same thing. The alignment makes it easy for people to tear the rotator cuff. They're set up for these injuries. Nobody's checking alignment, so nobody cares. Right in here, AC joint, you got to get rid of right there. Usually a couple treatments. These are usually not too difficult to just, the joint replaces itself pretty quickly. It's just cleaning out any inflammation in the joint. It's usually much easier to fix that, but it's just being jammed, which then congests it and clogs it, and you got to let it breathe a little bit.
At this point, it's like whatever I can do to get better. Yeah. Yeah.
There are so many components to what actually causes pain that some of those components can't be measured on a blood test or seen on an MRI, right? And that's part of what I term the immeasurables. And that component can be visualized when I go, I'll show you in a second. You're saying the marks represent something that can't be measured, but yet contribute heavily to why you're here.
Okay.
So kind of the first question is, how much better does it feel or change when I first clean it? You understand?
Yeah.
It's like wash the car and then see how it feels. Ed, man, it's gone from a 9 to a 5 just by cleaning my shoulder. Do you understand?
Yeah.
Right? So we don't know. You have to just clean it and see what, or I need an arthroscopic picture. I need a camera in there and show me exactly, Ed, no, the entire piece of cartilage is damaged. Gee whiz.
Yeah.
Well, then I guess you got to go talk to a surgeon.
Yeah.
But if there's some people, no, the anterior part's more damaged. The MRI report did not sort of specify if the whole thing or if just part of it is.
Gotcha.
So real quick over his AC joint right there. And that was like 3 or 4 swipes. That's why he's got AC joint pain. Again, this is postural. This all has to stretch. The tighter the pec gets, the more it pulls the shoulder forward and jams the AC joint. So that stretch I showed you earlier is about stretching this pec muscle, allowing your shoulder to come back. A lot of lactic acid here in the pec. Now we're going to the glenohumeral joint, so that's the top of his acromion right in there where the rotator cuff attaches. There's a little gap right there's the humerus. That's the end of his humerus. There's the end of his acromion, and this is what they call the rotator cuff. It's right there. So I'm just going to see how much blood flow we can get in there. Can we move your humerus out of the way for me, please? No, I'm kidding. I can't get. It's a hard area to access.
Yeah.
You said the AC joint easy to access, right?
Okay.
Inside here, I got a little slit to get right there. Is the only way to get access to where that cartilage. Does that make sense? Right there. It's just about that much territory is where I'm trying to push blood or encourage rinsing of that area in there. Have you had any biceps tendon issues here?
No.
Okay.
But I can feel that going down my bicep.
I got some. It has this little. I don't like it.
Yeah.
Just either we're catching it early. This shouldn't feel like that. So this just has a tight feelness to it. Some sort of fluid in here. The body's already putting up walls and cushions. What's going on?
Yeah.
Why does it need all that? And it comes out as a mark right here again. The mark directly correlates with what you can feel, what I can feel. When there's something there, it comes out. If there's nothing there, nothing comes out. The mark is just evidence of why you're here.
All right.
Deltoid attachment. This is where remember that tendonitis they're talking about? So this is a tendonitis here. So most of this is muscle belly. deltoid is all muscle from here to here, and then the tendon's just this little bit here before it goes to the bone.
Okay.
So definitely you got the tendons all, like the muscle belly here, not too much, but right over the attachment, you have a large mark. The weak point is where the tendon dives into the bone. That's what that is. That bump
Yeah.
is the attachment. So you always want to push that down onto attachment. People always massage towards the heart. Not in this case.
Yeah.
You want to press the attachment back down onto the bone. So for this muscle, you want to press that way. Right, so that the attachment comes into the bone. You don't want to be pulling the attachment off the bone.
Okay.
You want to be pressing the attachment, seating it back onto the bone, closing the potential wound that can be in there, not gaping it anyway. Yeah, that's not good. You've lost way too much range of motion getting that shoulder. So the idea is to actually put like on a book, be on your back, you understand? And you have like just holding here and seeing time and letting it stretch.
Okay.
Is that very painful?
Let me see.
Yeah.
Yeah, it's just I haven't even touched his left side yet. It's still elevated. I think the back side needs to be addressed. Yeah, a lot softer over here. Gee whiz. Gee whiz. Yeah. You were all doing one-arm push-ups. Like, yes, some right there's a little bit. Yeah. Okay. This right here is way too tight. Just, again, you're talking to Gumby, okay? I've been adjusted my whole life. Everybody's tighter than me. But again, it's more than even a normal person's tightness. This right here is way too rigid. This is what contributes to your lower back being overstressed, that the middle back is underworked. So we're just going to clean this up a little bit. So with the shoulder, the idea is to get, after care, especially when you have those marks on your back, get some Epsom salt. You take a cup with some water and some Epsom salt in it. Let this salt dissolve a little bit, and then rub the salt on the shoulder. Okay. And then take a hand towel or paper towel, dampen it in the salt water, and then lay that over the mark. Okay. And what that does is it draws out the acidity, inflammation inside, bruising, part of what they call that subchondral cyst. You have to take the surface stuff out in order for that to all drain. You understand? So it's all just cushioning and fluid that your body's put in there. Kind of like water balloons. It's just filled up all these areas. Sometimes it'll be called bursitis, which is the areas between the muscles will fill up with fluid. And there's a ton of what they call bursa, subacromial bursa. There's all these bursas around the shoulder that can fill with fluid. Again, your body's just trying to cushion things. Yeah, right here. This all has to get out of my way. Right there. That
What is that?
doesn't exist over here. That's part of what's blocking your shoulder blade from retracting. This can be, part of it is the roots of your neck injury, whiplash, or posture. But in essence, that's got to go down to allow the shoulder to come back. This injury back here throws the shoulder forward, then the shoulder shrug made the injury happen, right? So it made it more likely to happen. It's there, but it's much smaller. It's much smaller on his left. And then he's got a monster. Oh, yeah. Thank you, Ed. Look at that monster. That's a lump. He's got an injured joint in here that's caused it to flare. That throws his shoulder forward. He's got a rib injury, collision here, somebody, impact, or could have fallen on his arm. Could have been an arm fall. You land on your right side, land on your right elbow. This all jams into here. So it could have been a fall on his shoulder, fall on his elbow, then jammed this, and then the shoulder went forward to avoid it. All right, okay. There's an injury right here. Injury back here. Oh, there we go. It's all better. Shoulder doesn't want to be back here. Shoulder forward, jammed AC joint. Then you go do an exercise like a weighted shoulder shrug or bench pressing, and now but this is not nearly as pronounced on his left. This is what's preventing him from being able to retract his shoulder back when he was on his back earlier. The cool part about the gua sha is that if there's nothing there, nothing happens. I can't make a mark where there's nothing inside. It's like vacuuming. You only can draw out what's there. There's no dirt in the carpet. It just comes up clear.
So what I need to do, like more stretching exercises and stuff?
Above your head. I want to work on, that's my first at-home exercise for you. Now we're going to do two birds, one stone. We're going to push this in at the same time we're angling your shoulders back. So we're going to take pressure off your lower back, put it on your middle back, and at the same time start stretching your shoulders back. And I'll show you one way where we can put our arms up against the wall and have your arms sort of resting on like the headboard or on the wall, and then you just sort of move away from the wall, and that lets your arms go farther and farther down. But we have to get those arms eventually to the floor. I'll show you in a minute on the floor what I mean. But now they did a cortisone shot in here.
I've had two of them done. So the first one didn't take.
Okay.
And then the second one, it lasted for maybe 3 hours.
I understand.
Yeah.
So with that, there really isn't any. They're not really trying to benefit anything in that with the shot. They're trying to make it feel better, but there really isn't anything in there. It's not like PRP or some sort of some sort of stem cells where they're trying to regrow things. They're really just trying to numb it or make it feel better. What cortisone really does is it makes the tissue weep fluid, so it is an anti-inflammatory in that sense because it makes the tissue not able to hold fluid as well.
Okay.
But why is the fluid there? Because it's damaged, right? So none of it gets to the cause for why the fluid's there in the first place. Okay. That's good. All right, good. That's what we're dealing with back here is all this,
Yeah.
all that bruising. This is that knot right over,
Yeah, I
that
see
right
that.
upper side there.
Yeah.
Has to get cleaned out. And let's try to stretch it in a second. But let me
Okay.
have- maybe lay your back for me again.
Okay.
What it ultimately becomes is whether you're, whether or not we can get it to a point where it can feel better. Do you understand?
Yeah.
If we can't if we stretch your shoulders back and it still hurts, and you get your hands to the floor, you understand?
Yeah.
And your shoulders are level, and the neck is curved properly, then I guess que sera sera, right? But let's work on the components that I know we can fix first,
Okay.
right?
Yeah.
Let's get those better, and then let's see what's left.
Okay.
Right? So the answer is we really don't know until you go. It's like I'm getting my bathroom remodeled right now. And as you there can be problems, but until you tear things out, you don't know what's there.
Right.
You have to go through to figure out what's hidden, and it's the MRI misses things. I had a guy the other day. He had they told him a complete avulsion of his biceps tendon. Okay, so. Right, so there's 2 tendons up here, 1 down here. A complete avulsion of the distal tendon. If that was true, he should not be able to do this,
Yeah.
right? Because the bicep flexes right. Now, what I was feeling on physical examination is maybe 20%. I mean, there's definitely some level of it torn, and I think the surgeon was a little overzealous in telling him that he needed surgery yesterday, kind of idea. And I was going, no, let's try to push it back down. And he had a second opinion from another surgeon who was like, no, this is not a surgery. So I kind of back up from another surgeon, but the first surgeon was like, now he looked at the MRI report where it said complete avulsion, and that he never even touched the elbow. He never touched the problem. Does that make sense?
Yeah.
He just used the MRI as his basis for saying you need surgery now. I don't think he can't have a complete avulsion. I don't see it. So either the MRI is missing something, we get another MRI, maybe they didn't get a good shot of it.
Right.
Does that make sense?
Yeah.
So we have an MRI of your shoulder, but it's part of it's an opinion also. Do you understand? It's not the end all. It misses things, right? So
Have you had a second opinion on
I
it?
have not
Okay.
yet, so.
my point is that it's even it's the best we have,
Yeah.
but it's not perfect by any means, and so it misses a lot. Okay, there we go. I got your leg. There we go. Good. Okay. Yeah, tight. You've been on your toes a lot. A lot of basketball.
Yeah.
So his toes are just jammed from being on his toes, playing basketball and life. They're just jammed. Trying to unjam them a little bit. Oh, good. Oh, good. There you go. Okay.
Wow, was that behind my knee? Whoop. Yeah.
That was your knee. That was opening up. There's air bubbles. There's a joint between the tibia and the femur. And just trying to. The knee is avascular. You have to move the knee and pump the knee to rehydrate that knee. I'm gonna go real gentle with this one.
Yeah.
Try to press back with your elbow. How does that feel if you press back right there? You
Yeah,
okay?
I'm good.
You okay?
Yeah.
I'm gonna press. Keep pressing. Okay, it's okay. Just it's okay. It's okay. All right. Just try to pull that shoulder back. Same thing, press. Yeah. Yeah. This one's a little bit more fluid. It's just fluid.
Okay.
My dad would call it stuck in the mud. All right, a little bit more. It's okay. It's okay. Not coming back. All right. All right. Go ahead and tilt your head a little left for me a little bit. There we go. Yeah.
Wow.
It's fun.
Tilt your head to the left for me. Okay. Good. Okay. He's a good sport.
That's different.
Okay. All right. Go ahead and tilt your head to the right a little bit. Tilt right. Here we go. Yep. Go ahead and tilt to the right a little bit. There we go. Okay. Good. All right.
It's different.
Yeah, the idea is that I'm going to show you in a second, but put the arms aside. Put the arms aside. There we go. Let the arms relax. There you go. You okay?
Yep.
The idea, if you can maybe turn your head to me a little bit, towards me a little bit. The idea is that you be closer to the wall. Get the idea?
Yep.
And then eventually over time, get the idea?
Yep.
I can't handle that, Ed, so you just use the wall to help take yourself to the edge of what you can handle.
Okay.
and you're trying to stretch your shoulders back, and you do this for 10 minutes, and then okay, all right. Try to move farther down the wall,
Okay.
but your arms should be flat on the floor.
Got you.
You know, that's your goal. It's just time.
Sure, I can feel that all the way up.
Yep.
Yeah.
Well, you want to take it to the edge, then don't go so far. Then don't go so far back. Does that make sense?
Yeah.
If it's pinching too much,
Yeah.
but you want to go right to that edge,
Yeah.
wherever the edge is, and then back off a little bit, and then hold yourself. So ideally, you'd be like that close to the wall, like this is the wall right here,
Yeah. Okay.
and you relax your arm. Now relax your arm. Like let the pressure on the wall hold you. Does that make sense?
Yeah.
You're trying to let the muscle. Like I got your arm. You're trying to let it stretch. There you go. Let the arm go. There you go.
All right.
You gotta let go of that fear's about the dark side. You gotta let go of that fear. Sometimes look at it as like using your left hand to help the right. Does that make sense?
Yeah.
So use your good shoulder to guide the right one. Does that make sense?
Yeah.
Because the left shoulder you can get the left arm out of here. Right? So say if you get hold it like that. You get the idea?
Yeah.
And use your left hand. Can you handle that? You okay?
Yeah. Oh yeah. I'm good.
You know, use your left hand so you can relax the right. Let the left arm work. Does that make sense?
Yeah.
So that the right one can relax. Okay. Okay. All right.
I feel good.
All right. Thank you so
I
much.
appreciate it.
Thanks,
Thank
Rocky.
you.
You did really well.
All right, thank you.
Bud.